Hi. Thank you for joining me on Quarantine Positive series. This is our second talk. If you missed our previous talk, you can look up on YouTube or in Facebook for the first talk. This talk, I will speak about points, actually, which are very, very useful in treating headaches. It could be cluster headaches, tension headaches, or migraines. And in the research, when I was looking more deeper into these points of Dr. Yamamoto of YNSA that are not necessarily there for treating headaches, I found a very interesting correlation between a method called fascia manipulation and the location of these acupuncture points on the scalp of the epsilon points of Yamamoto. So we'll speak first about these very, very useful points. If you don't want to use a diagnosis and you just want to use them to treat the headaches and the migraines, any type of cluster headache or tension headache, you can use it without going to the diagnosis. What I do recommend that just have a feeling of on what side the headaches are occurring, okay? Now, these points are not only necessarily very, very useful for only treating headaches and migraines, but actually can be very, very useful for also treating motion of the neck, okay? Because when we come down into them, and I explain a bit more, you'll see where they located according to the anatomy trails and the trains of the fascia trains as well, and you'll see the connection. So with that, we'll go to the first point. First, I like to start out by just showing you location of the points and of these epsilon points that are very, very useful, and you can palpate in that region. And then from there, we'll go into deeper. So if we can look at our image here. So I'm just going to go up to my drawing board again. Go up to my drawing board. So first of all, to locate these points, I need to just understand what is my mid-forehead line, where my mid-forehead line is located, because these points sit on an anterior aspect of the temporalis muscle and sit on a mid-forehead line. And what do I mean by that? So I want to draw out the mid-forehead line. The mid-forehead line is actually a line, an imaginary line that runs from around gallbladder 14 point to do 17, approximately here. So we drawing out that mid-forehead line, okay? Because there's one point that's located in the center. Now I need to cross angles of what I call an apex line. These are only borders, okay? So if I would fold my ear inward, I'll come to a line here, which is apex. This would be an apex line, okay? And I need my anterior hairline. Okay, these are the anterior hairline of my patient. Okay, so these points, the first point, which is the pericardium, pericardium epsilon point, is located on the midway between the meeting point of the anterior hairline and that mid-forehead line, which is located about here. Okay, and the meeting point of a bit anterior, about a few millimeters, half a centimeter anterior to the apex line and on that mid-forehead line, so it'll be here. Basically, that point sits on the root of the ear. Okay, if we have the root of the ear here. Okay, this is actually what is called lung epsilon point, and this is heart epsilon point, which is also important in what we're going to be used. This is heart epsilon point. So the midway between the two is located approximately here, which is the pericardium epsilon point. So this pericardium epsilon point is one of the first points to relieve. Just a minute, we have people in the waiting room. So that point there is to relieve a lot of tension in the temporalis muscle And even by palpating and massaging this point, it will release a lot of tension in the temporalis muscle and give you more freedom of motion. Because think about it, that when you turn your temporalis, you actually, or turning your neck, a lot of tension will be accumulating here. So by doing that, you're also going to relieve the temporalis muscle, and you're going to relieve tension or headaches that are occurring because of a lot of stress around the temporalis muscle. And then we'll speak about the fascia in a minute, and you'll understand a bit more. So that's the heart, the pericardium channel. Now, this pericardium point also relieves pain and sensitivity in the upper, in the anterior area of the shoulder, around the area, if you can see up here, this region here, it will release tension in this region. So if you think about it, you're relieving tension here, you're relieving tension there, you're already relieving tension in the upper area of the head and neck. At the same time, you have to take into acknowledgement that needle in this pericardium point has some effect on the parasympathetic nerve system and stimulates the parasympathetic nerve system, so it actually also relaxes the patient in some manner. So you have that for this pericardium point. The next point, which we actually drew here, is actually the heart channel. Now the heart channel, or the heart epsilon point, also has an effect, mainly has an effect on the posterior or the upper shoulder region, the area of the shoulder blade, and also in the region of the spinoscapular region, okay, and releases tension there. So already with using this point, you've relieved tension in the upper shoulder and around the spinoscapula, or the area around the subscapularis muscle area there. So you've already relieved tension, so you're also getting more freedom of motion, of movement. You're also relieving tension, which is going up from the area of the shoulder up towards the head. So that's the heart point. The next 2 points, one is located actually here, right down here at the root of the ear, which is actually the gallbladder, okay, which is also a gallbladder epsilon point. Now the gallbladder epsilon point will release tension around the gallbladder channel, so it also has an effect again on the temporalis muscle. At the same time, you're relieving also tension around the temporalis muscle. A lot of work, as you can see, I'm working a lot of work on the temporalis muscle. A lot of headaches are occurring due to the sensitivity of the temporalis muscle, and soon when we start seeing what nerves, what veins, what arteries run in this temporalis muscle, and the fascia which surrounds it, when you relieve that tension, you're relieving that tension on those, on the nerves, on the blood vessels, and also reducing pain. So we have here the gallbladder. So that's the gallbladder point. And in between the two, between the heart and the gallbladder, we have liver. Okay, so this liver point has also an effect on the parasympathetic nerve system and calms and reduces sensitivity of the parasympathetic nerve system, according to the YNSA theory and from my practice. So you've reduced and you calm the patient down and reduce sensitivity. So these are these major points. Now, what is important around the heart point, that's around gallbladder 8 point. So we can understand gallbladder 8 also has an effect on the head. So we're reducing sensitivity there. So now, how come these points work? So let's explain a bit more of these after we've gone through the location. Okay, so as we have in this drawing here, we can see the actually in yellow we have the trigeminal nerve, also the facial nerve. So think about it that you have a lot of sensitivity on the trigeminal nerve, and if you reduce or take off pressure off the trigeminal nerve, you're also going to have an effect on headaches and migraines. Also look at the blood vessels that you have here in the area of the temporal, and that go down right throughout the body towards the mandibula and etc. in the lower mouth. As you can see, the nerves there. Now, what is important, when we come in to speak about fascia or this connective tissue or understanding of working with fascia, we have to understand that this fascia tissue actually covers all the arteries, covers all the nerve system, all the nerves, sorry, all the lymph glands, everything is covered by this fascia. And a lot of times, fascia has a gliding movement, okay? Now, on fascia, on the fascia tissue, you have what is called mechanoreceptors. Now, mechanoreceptors respond to stretch. And even when you have slight tension in certain areas, okay, or tension on that fascia, it's going to cause some type of stretch on the fascia tissue, which is going to cause pressure on the on that fascia, on the mechanoreceptors. That's going to send a signal of pain towards the brain or towards the body itself. Now, what is important about this fascia and this this fascia tissue, 6 to 10%, there are times 6 to 10 more receptors for pain on the fascia. That means muscle pain is 10 to 6% less than fascial pain. Fascial pain, think about that, you have a lot of 6 to 10% more or times 6, 10 pain levels than in the fascia than the muscles. So understand how much tension could be caused from the region in that fascia. And the points that I told you actually there, or actually when you come into the fascia manipulation technique, those are actually points or channels that actually by even massaging that, you get in a gliding movement on the fascia, okay? Opening that gliding, because the fascia has layers that have collagen fibers, and in between the collagen fibers, you have hyaluronic acid, okay? And sometimes the fascia levels get stuck to each other and don't allow gliding motion. So anytime you move your head in a certain direction or cause extra pressure there, you're going to get that more sensitivity of pain. So actually what you doing actually in those points, you can needle them or even acupressure there, you actually getting that gliding motion back, and then you're reducing a lot of sensitivity and a lot of pain throughout the fascia in the temporal region. But as you can see now, if we go into fascia trains, this is an image that's being taken from a ponic nerve of the of just looking at the channels here of the fascia, which looks very, very similar to the acupuncture channels. And we can see that if we have, this is that area of the heart, this is that area of the pericardium, okay, which we spoke about, and this is posterior areas. But even by massaging this channel, we're going to have reducement of the sensitivity around the temporalis muscle and treat those headaches. At the same time, if you look at these trains, when I spoke about the areas that these hard point relieves, this is why that hard point there actually relieves the area of the spinoscapular region and also the subscapularis muscle, the infrascapularis muscle, can relieve tension there, and also the area of the shoulder, so you're getting more of that motion. Okay, so this is just to show the anatomy trains of the fascia and how by needling those points, you're actually reducing tension that might be occurring from the lower area here, okay? And as you can see here, this, I didn't speak about it, but you also have the same area if you want to relieve pain. This is just by doing a fascia manipulation area around the area of the occiput, occipital protuberance, and reducing sensitivity, which will also reduce sensitivity here in the area of the frontal lobe. Now, just for an example, lately, I don't know why, I've had a lot of patients that have been coming into my clinic suffering from which they were actually told that they have some kind of trigeminal pain, but actually when the trigeminal nerve was actually tested in all the Western medicine, they saw there's no damage or any effect on the trigeminal nerve, so they cannot understand why they have this pain. So they say that this is idiopathic pain. We don't know why you have it and why you've been suffering from a couple of months. And as you can see, just using those points here where I spoke about, and also manipulating or giving massage to the area of these points that you can see here, in front of you, I actually reduce the pain and even stop this reoccurring of pain, which they feel every time they have a slight pressure or slight tension and even twitching, raising the eyebrows or moving the mouth, and then they get that a strong sensitivity of pain. So this is the connection a lot of times I found between the epsilon points of the YNSA and the fascia tissue, and going into deeper, how the connection between these channels here of the, because we have 12 channels here of the epsilon points of Yamamoto, which also come into how we can treat TMM, the sinew channels, or what we call here in Israel the TMM channels, just by reducing pain here and having an effect throughout the body. So thank you all of you for attending. I hope you found this very, very useful, and you can already start applying it today in your clinic. If you wish to contact me, you have my email address here, which is pnimaac@gmail.com, or you can even visit my website and be more in touch with us, or even sign up to our newsletter, or see when the next full seminar is, and join us. So thank you very much for your time. Hope you keep you all safe. Best wishes.